am Dr. Susan Bushinski, and I'm going to be testing the DTRs, which are the deep tendon reflexes. You will need you need an exam table to have them sit on. Their feet need to be elevated up off the floor, and you need to have a reflex hammer, which comes in different shapes and sizes. This one's a triangular rubber head. The first reflex we're going to test is the biceps tendon. And the way we do this is we locate the antecubital fossa, and we're going to go about 2 to 3 centimeters above the antecubital fossa. You want to rest the patient's hand on their thigh. For the biceps, we're testing the C5 and C6 nerve roots. You're going to firmly push your thumb over the tendon and curl your fingers around the back of the arm. You're going to strike your thumbnail, and you should see movement in the lower hand, and actually what you're seeing is extension of the forearm, like a twitching of the hand slightly. The next tendon that we're going to test is going to be the triceps tendon, and this tests for C7 and C8 nerve roots. You're going to cradle the person's arm in your hand like this, have it real loose. You're going to locate the olecranon, which is the name of the elbow, and come up about 2 to 3 centimeters to the insertion point of the una, on the back posterior side of the arm, and you're going to strike directly on the arm. And what you will see is you will see an extension of the forearm for that. And again, that's testing a C7 and C8. And the next deep tendon reflex that we're going to test is the brachioradialis. This is on the lower part of the arm. You want to find the stylus process, which is the bony prominent of your own of your radius on your arm that sticks out at your wrist, and go 2 to 3 centimeters above that on the lateral side of your arm. You're going to rest the patient's arm on your thigh, and you're going to strike directly. The brachioradialis tests the C5 and C6 nerve roots, and you're going to strike, and what you will see is you will see supination of the palm, where it will twist and turn upwards, and you will see forearm flexion at the elbow. The next reflex we're going to test is the patellar reflex, and this is testing L2 through L4. This is the knee jerk reflex. You want to have the leg freely hanging off the table. You want to locate the soft spot below the patella, which is the circular bone that makes up your kneecap, and the bones that come up from the lower leg. You're going to strike directly on this. The patella tests, again, the L2 through L4 nerve root, and you're going to strike with your reflex hammer. You will see a kicking out of the leg. You want to try to test and have your hand on the quadriceps muscles while you're testing to check for any adjacent movement of adjacent muscles to the area. The next reflex we're going to test is the Achilles tendon, which is the posterior part of the heel. The Achilles actually cradles the calcaneus, which is the heel bone, and you're going to strike right here. It's almost parallel to the bump that is the side of your ankle. You're going to do directly contact that. You want to cradle their foot in your hand when you strike, and strike directly. And what you will see is you will see plantar flexion of the foot with striking of the tendon. And that is testing the S1 nerve root. And then finally, we're going to test for the Bushinski reflex, and this is the bottom of the foot. Again, you're going to cradle their foot on your hand. You're going to use the pointed end of your reflex hammer. You are actually testing S1 nerve root. You are going to push firmly along the lateral edge of the foot across the toe pads underneath the metatarsal heads. And what you're looking for is downward pointing of the toe like a ballerina. The abnormal response, or a positive Bushinski, would be if there were fanning of the toes and the toe itself would stick outwards to the side. That is normal up to age 2 in an infant, but once they hit age 2, they should have the adult normal response, which is the pointing of the toe and the dorsiflexion of the foot. And you always grade your reflexes on the reflex grading scale, which is 0 to 5. And then the other thing that you want to do is you always want to assess both sides as you go from the upper body to the lower body, comparing side to side for any abnormalities, and also looking for symmetry in the response. And that concludes the testing of the DTRs.
You didn't have timer on.